loved one have high cholesterol? Are you or they taking a cholesterol-lowering drug, like a statin? I'm going to reveal 3 things you must know about cholesterol. Hello, my name is Diamond Fernandez. I am the founder and director of the HeartFit Clinic, and I'm also a published author of Beating Heart Disease, 5 Powerful Pillars to Prevent and Reverse Heart Disease. Number 1, the majority of people who have heart attacks and strokes have normal cholesterol. So it goes beyond cholesterol. Heart health and artery clogging is more about particle size and inflammation. Bad cholesterol is LDL, comes in different shapes and sizes. The small ones are more dangerous. Let me explain. It's like tennis balls and golf balls. Imagine the artery is protected by a tennis net. Tennis balls will not go through a tennis net, but golf balls will. Here we can see that all these people have normal cholesterol, but Maria is at risk because she's got a lot more golf balls. In this example, all these people have high cholesterol, but Jerry does not require a cholesterol-lowering pill like a statin. There's a complicated process in which how cholesterol happens, but I'm going to explain it in 4 or 5 different steps. Small LDL particles cross the lining of the artery. Then LDL gets oxidized or broken down. Monocytes enter the artery and eat the oxidized cholesterol. It then becomes a macrophage. The macrophage becomes a foam cell, which is a plaque. Number 2, the majority of heart attacks and strokes occur with blockages that are less than 50%. Just like that pimple on a face, everyone's had it and everyone's had it pop. A pimple pop inside your artery is a heart attack. Thin skin, it makes the plaque more vulnerable to rupture. And here you can see now the plaque rupturing. Your arteries are a muscle, not a pipe. Cholesterol is required for sex hormones, repair, cell function, and brain function. It goes beyond cholesterol. Number 3, cholesterol-lowering drugs are not the answer to lowering inflammation. Statins come with their side effects, many times underreported. It's important to understand the number needed to treat. Let me explain drug trials to you. Here it sounds very appetizing and very great marketing to show that we can lower cholesterol by 74%, which sounds really great. But let me explain the primary endpoints, which is composite endpoints, which is cardiovascular death, myocardial infarction, which is a heart attack, stroke, or revascularization, which is another stent or bypass surgery. Here you can see that the drugs, 1,344 people who were taking the drug had a problem happen, which is 9.8% of that population. The placebo group, the people that thought that they were taking the drug, 1,563 people of that population, which is 11.3%. If we take the difference, it's only a 1.5% reduction. So we lower our risk by 74%. We only get a 1.5% absolute risk reduction in treating cardiovascular endpoints. Here's another example. Lipitor reduced the risk of a heart attack by 36%. Who would not want to be on this drug? However, when you look at the relative risk, this is how it's reported. 2 out of 100 people taking this drug have had a problem, where here on the right, 3 out of 100 people had a problem. Therefore, we take that number 1 divided by 2% over 3%, which ends up getting out to a relative risk of 34%. The absolute risk, which is 3% minus 2%, which is the number needed to treat. So the number needed to treat is really the answer that needed to require, and that is a number needed to treat of 100. What that means is that 100 people need to walk into a doctor's office for 1 person to benefit. So the number needed to treat, are you hoping that you're going to be that 1 out of whatever number it is to be of benefit? Now, if you're not doing anything, I think it's important to play your odds and take that drug. But do you want to be the exception? Which is important to understand the absolute risk reduction of a heart attack or stroke. If your doctor is not talking to you about particle size, inflammation, or anything that I've mentioned, you have to get more information. I have so much more to share. You only have one heart. Love it. Get your book today or contact us and call our clinic today at 403-870-4348 or heartfit.ca. We look forward to helping you live happier, healthier, and longer.